Hello, today we are learning about medication assistance. As you can see here, medication come in a single packet and they come in a bottle. They come in a bingo card, the same kind of medication in one packet, or they come in a med book. It's like all the medication are packed for the morning, evening, noon, and nighttime, like that. For the HCA skill test, the client is sitting at a table while this care is provided. So you are expecting a person sitting at the table. The supplies we need are water in a cup, a straw, a napkin, a little cup to put the medicine in, and gloves. Before we do anything, I like just to remind you the 5 rights of medication. Those are like the right client, the right medication, the right dosage, the right time, and the right route. You need to remember this. And the 3 checks are the other things that we do 3 times. First, when you give the medication from the storage, when you get it, that's the first check. And before you pour the medication in a cup, that's the second check. And after you give the medication, you check it as a third check. So the first thing is you check the client medication schedule. It says Tylenol 650 milligram PO 2 times a day, 8 a.m., 8 p.m. The client is dismissed. This is his birthday, and this is today's day. Now, first is first. The first thing you need to do is to successfully demonstrate this skill is you need to use the SWIPE method, communication, client rights, and common care practices. Please remember this anytime you do a skill. Every time you have to assemble your appropriate equipment. In this case, we already discussed it. You need the medication, you need the water, the cup, the napkin, the straws, and things like that. And you need to wash your hands before and after. You need to identify yourself. My name is so and so. I'm here to give you a medication and explain what you're going to do. And make sure you know that's the right client, that's the correct client. Remind the client it is the scheduled time to take the prescribed medication. And then select the correct medication bottle labeled with the client's name. You go and check this is the right medication and the right client, the right medication. And you pick up the card or bottle that has the medication on it. And then take the medication container from where it is stored, and that's the first check we do. Look at the label and verify the 5 rights. This is the right person, the right medication, which is Tylenol, the right dosage, the right amount, the right route, which is PO or by mouth, and the right time, 2 times a day, which is 8 a.m. and 8 p.m. We check it the first time when we get it first. And the second check we do is we open the container and look at the label, and we have to verify the 5 rights again. The second time, this is the right client, the right medication, which is Tylenol, 650 milligrams, the dosage, PO, the route they're taking 2 times a day, 8 a.m. and 8 p.m. We check the second time. And then we pour the medication from the bottle to the lid cup without touching the medication. Or we can put it in a cup. We already have a cup like that, and we can put it on a client's hand like this, or we can give the client like that with water. Give the client the correct number of pills by pouring them from the lid cup to their hand. You can do it like that, or without touching the medication, or we can give them in the little cup so they can put it in their mouth by their own. And then we need to cue the client to take the medication. We need to assist the client to take medication without having your hand over the client's hand, or tipping the client's hand to place pill into the client's mouth, or placing the pill directly into the client's mouth. And then offer the client a full glass of fluid or for oral medication. Remember, do not put client medication to the mouth without delegation. You need to have a delegation to do that. And then make sure the client takes the medication. You need to observe and make sure the medication is taken. Ask client or check if medication is swallowed, like that. Now we close the medication container and put it back in the appropriate place. and we need to verify the 5 rights again this time. And this is the right client, the right medication, the right dosage 650 milligram, the right route, it's PO by mouth, and the right time, 2 times a day, 8 a.m. and 8 p.m. Now we finished all the checking and we gave the medication. Now we have to document in here, and we need to initial and we need to sign at the bottom. Document that the client has taken the medication. If they have not, document that too. And then you wash your hand and you're done. These are the references that I used. Thank you very much.